This is for, my supervisor and our research team as well. So this is follow-up to an earlier study we actually conducted that was recently published in Neurology. So in this study, we had looked at whether or not oral anticoagulant use in patients with atrial fibrillation decreases the risk of dementia. And in that study, we found that oral anticoagulant use was associated with a 10% decreased risk of dementia. And although, we might think that, for example, of course, we would be prescribing oral anticoagulants in these patients anyways, but given the relevant clinical population for dementia, oftentimes we might see that oral anticoagulants are not adequately prescribed, despite them being indicated for older patients in particular. So this was an important finding that, prescribing these drugs is important long-term as well to decrease dementia risk in these patients. Of course, with oral anticoagulants, there are the different types of oral anticoagulants as well. And there's indication to suggest that DOACs would be preferable over VKAs in this regard, but then the DOACs individually differ as well. So we were interested in seeing, for example, whether apixaban was more effective in preventing or reducing the risk of dementia compared to rivaroxaban. In this case, these are early findings. With this study, it's still in progress, but so far we found that there isn't a difference between apixaban and rivaroxaban with respect to dementia risk. So perhaps this might differ a little bit depending on individual patient characteristics as well. But overall, we found that with respect to dementia risk, there shouldn't be, you could prescribe both and it wouldn't be a consideration. That's right.